Nothing in breast imaging causes more worry among patients than skin changes involving the breast. Their greatest fear? Inflammatory breast cancer. Inflammatory breast cancer is a very aggressive subtype of breast cancer. Fortunately, it's quite rare, occurring in only 1 to 6% of all breast cancer diagnosed. It presents as an acute onset of inflamed erythematous skin. This is due to malignant cells invading the dermal lymphatics. There are several signs of inflammatory breast cancer, the main one being an acute onset of inflamed erythematous skin. This can take several forms. It can be red, thickened skin that has an orange peel or peau d'orange appearance. Secondly, it can present as a bruise or insect bite that just doesn't seem to go away. And lastly, a non-painful mastitis. Oftentimes, this can be missed for several weeks or even months. On imaging, inflammatory breast cancer can be very subtle due to the lack of an underlying mass. On mammography, what you're looking for is simply skin thickening, trabecular thickening, or perhaps diffuse increased density within one breast. On ultrasound, oftentimes there's axillary lymphadenopathy, as well as skin thickening, and perhaps diffuse increased echogenicity in the subcutaneous fat of the breast. Here's an example of skin thickening on a CT scan involving the left breast, skin thickening on ultrasound, and mammography. Unfortunately, the mammogram also shows axillary lymphadenopathy. More examples of skin thickening on mammography and diffuse skin thickening present on a breast MRI, as well as axillary lymphadenopathy. Inflammatory breast cancer usually requires a skin punch biopsy for definitive diagnosis. The staging is quite advanced. Because the tumor is involving the skin, the overall stage is limited to only 3 choices: stage 3B, 3C, or 4, depending on the presence or absence of metastases to lymph nodes or other areas of the body. One diagnostic challenge can be distinguishing inflammatory breast cancer from locally advanced cancer. The way to distinguish between these two is the timing of onset, as locally advanced cancer usually takes months to years to develop, whereas inflammatory breast cancer occurs in a matter of weeks to months. Secondly, the presence of a large underlying mass, multiple masses, or calcifications point more towards locally advanced breast cancer. Another diagnostic challenge is determining mastitis from inflammatory breast cancer. Here's an example of a mammogram with very subtle skin thickening involving the left breast. It's important for technologists to always examine the breast for any suspicious redness. One way to try and sort out whether the redness is due to mastitis or inflammatory breast cancer is the presence or absence of pain. Inflammatory breast cancer is typically not painful, where mastitis is. An abscess or fluid collection points more towards infection. And lastly, whether or not it responds to antibiotics. For any erythematous breast, antibiotics should be prescribed for presumed mastitis, but it's important to always schedule a follow-up exam to ensure the redness resolves completely.
Thank you for watching. Please click subscribe to see more of our content, or go to MAMMOGUIDE.COM to learn more about breast imaging.